Hi, I'm Lori Healy, and I'm going to be doing a head-to-toe assessment on my friend Calzuntley. And so I'm going to check in with her and introduce myself. I'm going to ask her if she's okay for me to perform a head-to-toe assessment. Is that okay with you?
Yes.
Yeah. Okay.
Yes.
And I'm going to check her name and date of birth with her band if she's in the hospital, or just ask her verbally and check it with the chart. But before I get started, I'm actually going to perform privacy precautions. So we'll draw a curtain. I will be washing my hands, so hygiene. And then again, the safety measures, like checking to make sure that I have the right patient, the right person here with the band. And if she was in a hospital bed, make sure the rails are up, etc. So I start by inspecting the overall body. I'm going to be looking at the coloring of the skin. I'm going to be looking to see if there's any abnormalities, or any masses or anything like that, just by visualizing. See if the skin is normal for her ethnicity, or whether there's any jaundice or any evidence of not having enough oxygen, so cyanosis, so the lips getting a little blue, that kind of thing. So I'm going to be looking for good oxygenation, good circulation. And so then we'll start with the head and work our way down to the toes, and we will first inspect the hair and the symmetry of the head. And if it was someone I didn't know, and we would have gloves because in case they had some lice or something along those lines. But so I'll be just looking at the symmetry of the head, and then I'll be looking through the hair itself. So I will be looking closely here with a nice bright light, make sure that I don't see any infestations. And she's good there. And then I'll be feeling the head, and just to see if there's any masses or any abnormalities in the shape of the head. And everything feels normal there. And do you have any pain? Do you have any headaches or anything like that, or any issues with your head?
No.
Okay, great. With each system, I'm going to be inspecting, palpating, percussing, and auscultating, except for the abdomen, which I'll be inspecting, auscultating, then percussing and palpating. And I'm also going to do the vital signs. So I should have mentioned that before I even do the head. I will go ahead and do the vital signs, which we already did. I used a manual cuff. She's 110/65 with her blood pressure. Actually, I did not do the pulse ox yet. I will check that right now to see what her heart rate is and her oxygen level. I did her temperature, and that is 98 Fahrenheit or 36.6 degrees Celsius. Her BMI is 20.4 because she's 5'7" and 130 pounds. And her blood oxygen is 99, and her heart rate is 66. Okay, so then I would start with the head, like what I just did with the inspection and palpating, etc. And then I move down to the face, and I'm looking at the symmetry of the face and the distance between her eyes, making sure that's about 3 inches apart there across the ears, to see if those are symmetrical, and make sure there's nothing on the outer part of the ear. any uric acid crystals. It could indicate gout. Looking at her neck too, and just the chest and shoulders, just to see if there's any deviation from midline. And so then from here, I will also go into the head, eyes, ears, nose, and throat, and we'll be looking at the eyes first. So I'm going to pretend I have a pen light, because I don't, and I'm using my phone to do this, so I can't use my phone for the flashlight. But we dim the lights, and I'm going to just check for reactivity with her pupils. So I'm going to be bringing the pen light over from the side to this eye here, and then check to see if that pupil constricts with the light, and then I do that on the other side here. And yes, she's Perla, so her eyes are equal, round, reactive to light. The pupils are equal and reactive and round, and they're symmetrical. There's no unusual deviations in the iris or the pupil, and the sclera is clear, so no indication of jaundice. It's not red, so no inflammation there. So then I go to the ears, and this is going to be my scope, and I'm going to be pulling the pin out of the ear up and back, because she's an adult, so that's how I would be inspecting the inside of the ear. I'm going to look at the tympanic membrane, and that's a pearly gray. That's a normal color. And I'm going to ask if there's any issues with your ears. Have you had any trouble in the past with your ears? No? Okay.
I have a little tinnitus.
Ah, okay. When did that start?
When I was young.
Oh, okay. And so how old were you? And
I want to say 12.
is that in both ears?
My left is a bit more than the right.
Okay. And is it constant, or does it come and go?
It's constant.
Okay. So, again, as we're doing the physical inspection, we could maybe asking questions like that. Because of the time constraints here, I won't go into most of the details with her, but that is a good example of what we will do, as we go along. And of course, again, the beginning of the inspection and then just the introduction, I'm going to be kind of observing her and her affect and her mood in general, how well she responds to my questions, etc. And kind of get a idea if she is what her mental status is, just by asking her some basic questions about her health history, some current events, etc. So to make sure she's awake, alert, and oriented, ×4, person, place, etc. And so let me go on now to the other ear. I would be doing, again, inspecting the ear, pulling back, looking for any issues there, no inflammation, and the tympanic membrane is pearly gray. So then I'll be looking in the nose, and I'll just be using my light to shine into the nostrils, and that is pink, not inflamed, so those veneries look normal. And then I'm going to have her open her mouth, and I'm going to look at her tongue, and I'm going to look at her dentation, her teeth. Does she have any cavities? The tongue is pink and moist, so it doesn't look like there's any dehydration issues there. And I'll have you smile, frown, and then puff your cheeks out. So smile, frown, and puff your cheeks out. Okay. So cranial nerve 7 is intact, and then we're going to go into looking at the The neck itself, so visualizing where the thyroid is, and looking for any masses, to see if you can visually see anything with the lymph nodes, if there are any protrusions there. And so then we're going to palpate, and I'll be feeling for, I'll feel for the pulse too here, just to make sure that we've got a temporal pulse that's even on both sides, and yes, she's 2+ pounding. So pre-auricular for the ears, the lymph nodes, post-auricular, occipital. What I'll do, mandibular, submental, and continue down the cervical, posterior, and supraclavicular, and all those lymph nodes feel fine, and nothing is enlarged. Is anything tender?
No.
Any areas that have been palpating so far? Okay. So then we're going to be looking at the chest. We can do some more nerve tests, like the have you try and shrug against resistance here, okay? And have you turn your head to the right and the left, and up and down, okay? And so, oh, I forgot to mention too, with the ears, the cone of light. We've been looking for the cone of light. On the right side, it will be at 5 o'clock, and at the on the left side, it'll be 7 o'clock. So I'm also going to have her stick out her tongue, and I'm going to look at the uvula, okay, and I'm going to have her say ah, okay, and it's no deviation from the midline, so that's cranial nerve 9, and so then we're also going to check her sense of smell while we're here, and I'm going to have her close her eyes, and then I'm going to grab something. Okay, tell me what you smell.
I smell beer.
Okay, so we may have a problem with the nerve there. It's actually apple cider, hard cider.
Oh.
But it's probably been rinsed out. So that would be let me think here. Cranial nerve 1. And so then we go to look at the other cranial nerves, like how she's talking and if she can swallow. Do you have any issues with swallowing? No? Okay, so that's the vagus nerve, cranial nerve 10. If she had hoarseness or difficulty swallowing, that could indicate a problem there. So back to the throat, we're going to be looking for, now that I've inspected, we're going to be looking for any goiters, any swelling with the thyroid. Does that feel okay?
Mm-hmm.
Okay, and can
Yeah.
you swallow for me? Okay. I know that's hard to do when someone's got their fingers there. Have you ever had any thyroid issues? No? Okay. All right. So again, we're looking at the chest. We're going to look at the upper extremities. I'll be checking some reflexes. We'll be checking here for like cogwheeling. This can happen when someone has Parkinson's. There's a rigidity there in the elbow. Antecubital. Okay, no cogwheeling. And I'll be checking her capillary refill. And I would continue doing this. On the other hand, it's all 1 to 2 second refill time, so that's good. Also, I can check to see with the skin if she has, if she's dry, with the skin turgor test, and it snaps right back into place, so that means that there's no tenting, and so she is not dehydrated. We could even have her do some more neurological tests here with, can I have you put your palms on your legs and then turn them like this, up and down, okay, great, yeah. So that, just testing all the cranial nerves, etc. So now I'll go ahead and start with the exam for the heart. And so we're gonna do 5 points. I'm gonna start with the aorta, and I'll be listening. Okay, she can just breathe normally here. So I'm gonna be listening to the heart. And then the pulmonary valve. Erb's point. Tricuspid. And then the mitral, so that's going to be midclavicular down to the midline here under the breast tissue for female. This is the PMI, so point of maximal impulse. This would be the apical pulse that we would listen to if someone was going to be given digoxin or something along those lines, where we need to make sure that their pulse is within normal limits. So that would be 60 to 100. We would listen to that apical pulse for 1 minute to determine. And everything sounds good. S1, S2, no extra heart sounds. And I'm going to listen now with the bell to see if I hear any murmurs. Actually, we don't need to do Erb's point because there's no valve there, but okay. All right, no heart murmurs. Everything sounds good there. Have you ever had any heart trouble? No, okay. No. Any family history of heart trouble?
My grandpa had bypasses.
Okay.
Yeah.
Yeah.
I think it was like 2 double or triple bypasses.
Oh wow.
I know.
Wow. And what did he die of? Was it heart related? Do you know?
I don't remember.
Okay.
It could have been.
Yeah.
He was also became diabetic.
Oh, okay. And
He
that
died-
will
he
affect the
died
heart
young,
too.
yeah. It's
Okay.
like 70.
Okay, because the blood vessels, are affected with diabetes. Okay.
That's the only family member I know of.
Okay. Yeah, but no issues yourself.
No.
They've never been told you've had any problems with that. Okay. So, and I, of course, at each system, I would be asking all those questions, and that'll be in the written health history that we're going to do. This would be, again, more lengthy if I was asking all the questions for each system. But we're going to look at JVD as well, for JVD, jugular vascular distension there. And so I'm going to have you turn your head to the side, okay? So I'm looking for a protrusion here of the jugular vein. I don't see anything along those lines. Okay, no problems there, no raised pulsating jugular vein. And so I'll also be palpating, as I did, that for the thyroid, but also the trachea to make sure that's midline, etc. No problems with swallowing, like we were talking about, as far as the cranial nerve nerve 10. And also with the cranial nerve 2, that was the using the shrugging the shoulders with some resistance and the head side to side that we did earlier. So cranial nerve 11. And so we've already done the lymph nodes. We're going to move down now to the abdomen. And so I will have Cosently lie down, and we'll be inspecting her stomach. And again, with the abdomen, we're going to inspect, auscultate, percuss, and then palpate, because that would, if we did it in the usual, yeah, that's good, thanks. Can I push this down just a little bit too? Okay, that's fine, yeah. So, because we don't want to disturb that stomach area, let me turn this a little bit. So, okay, good. We've got a good visual now of the abdomen. So I'm going to just be checking everything. And also, before I do this, we're going to be skipping the breast exam, but I would have done a breast exam, a visual. I would have been palpating for any masses, any discharge, nipple discharge, any family history of breast cancer, etc. We would talk about getting, yearly mammograms and so forth. And then we would move on to the stomach. So I'm looking at the stomach. There's no protrusions. It's not concave. It's not protruding. There's no ascites, and the color is normal. No jaundice. It looks normal for her ethnicity. I can even watch how she's breathing and just see if she's using any accessory muscles, etc. That's a kind of preliminary to when we listen to the lungs, which we'll do when she sits up again. So I don't see anything unusual. Do you have any issues with your abdomen? Do you have any tender spots generally, or?
No.
When was your last bowel movement?
This morning.
Okay. And what was the color and consistency of the stool? Brown. Okay.
Normal.
Yeah, like medium soft or yeah.
I mean, yeah.
Okay. How often do you go to have a bowel movement?
Once or twice a day usually.
Okay. Okay, great. And then urination. Are you having any trouble with urination?
No.
Okay, great. So tell me what the color is of your urine, and
it's light,
like a yellow.
Yeah,
Okay.
light.
And any odor, any pain with urinating?
No.
Okay. Any history of any urinary problems?
Not that I know of.
Okay.
No.
All right. And then, of course, too, we could talk about the reproductive system. We could discuss, since we're not going to be doing a genital exam, we could remind her about regular pap smears, talk about discharge, her menstrual cycle, if it's regular, how many children, or if she's had any children, all of those issues. Of course, before we did any of that, we would be doing a visual inspection. But again, we're not going to be doing that in this video, so we'll move on again to the stomach. So anyhow, I visualized, and now I'm going to listen. And I'm going to start with the right lower quadrant with my diaphragm. She should have 5 to 30 vowel sounds in a minute. That would be normal. If it's less than that, then it's hypoactive. If it's more than that, it's hyperactive. Normal vowel sounds here throughout. I'd also be listening I visually looked at the aorta. I want to just check that aortic artery too by listening to see if I'm hearing any swishing, any bruit. And I do not. And then I'm going to be listening to, I'll go up a little bit more for that aorta too. And then I'll be listening for the renal arteries. Okay, and the iliac. No bruit here. So then I want to percuss, if I percuss, which doesn't always happen in exams, but using the two-finger technique, so I'll be listening for dullness in the areas of the organs like the liver, and then tympanic sounds for like the bladder that will the intestines, if they're empty. So that all sounds normal. I could be checking the spleen as well. And so I've done my percussion, and then I'm going to do palpating. I'm going to do a light palpation, and then I will do a deeper palpation. So the light palpation is going to be about 2 centimeters, starting in the lower quadrant. Any tenderness here with, so basically I'm looking more for tenderness, and then when I do the deep palpation, I'll be looking for any masses, unusual, like enlargement of the liver, etc. So now I'm going to be going about 4 centimeters, and I'll be palpating. You're doing okay?
Yeah.
Anything tender here?
No.
Okay. All right. So everything feels good there. I don't feel any masses. I don't feel any unusual spots. As far as the liver, for instance, is just below the few 3 ribs there, and it's not protruding or extending beyond where it would normally be in that area. Okay, so moving on, I'm now going to just be observing the legs and the feet, and then we will have her sit up, and I'll inspect the back, and I'll do the lung sounds. So I'm going to lift up the pant legs here. We're going to pretend I can see all of it. She's cold, so I don't want to have her stripped down to her undies here. But I'm going to go ahead and take the socks off. So again, just a visual inspection, hair pattern, is there any edema? I'd be feeling pulses after I do the inspection. Everything is normal as far as color goes. The toenails look good. There's no fungus or ingrown toenails. Also no, I meant to mention a top here with the nail beds on the hands. There's no rounding, it doesn't look like there's any issues with breathing. And I'm going to feel like the popliteal now. Feel the pulse. I can even start at the femoral. Popliteal. Tibialis posterior. I can do some nerve tests on her here and musculoskeletal strength. Push against my hands. Yeah. Okay. And then like pull back against. Yeah. Great. Okay. Fantastic. I can do the Babinski test. So where I do down the middle here to see what happens with her toe reflexes. Okay. Good. That's normal too. Alrighty. So I will also be checking cap refill here. And that is normal. Seconds or less on that. Also with a visual inspection throughout the body, of course, but even between the toes, we'd be looking for any unusual moles, growths, things like that. And that's all clear. And then I would also be, after the inspection, I would be checking for sensation to make sure that her she is feeling her nerves are intact, and I could use a variety of devices for that. But I could ask her to like pretend I've got this. Can you feel that?
Yes.
Yeah.
Yes. Yep, I feel it.
Okay. Yeah. Just every time I'm pushing, let me know if you feel it.
Yes. Yes. Yes.
Okay.
Yep.
Okay.
I feel it. Yes. 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 Yes.
And any pain anywhere?
Yes. No.
Okay.
Yes, I feel it.
Okay. Here.
Yes.
Okay.
Yep.
So
Yeah.
she's feeling all that, and I would be checking that with her hands as well. And just in general, kind of checking for edema. So be using my fingers, pressing along the tibia, just to be checking here if there's any indentation, any pitting edema. Yeah, no, there's no edema here. So she's in good shape there. Okay, so I'm going to go ahead and have you sit up again, Cosently, and then I'll be listening to the lungs. Okay. So,
Do you want me to,
listen. Oh,
like,
what's that?
are you gonna do my back?
I will,
Or-
but
okay.
I'm going to do your front first, so I'm
Okay.
going to listen to the. So I'm just going to have you take some nice deep breaths. We'll start at the apex here. Moving down. And I'm going to have you lift up your right breast for me so that I can listen underneath your breast, the lower lobes. The right's going to have 3 lobes, the left it'll have 2 because the heart, of course. And lift your left breast for me so you can another deep breath. Okay, I'll be listening here more mid-axle as well for the lower lobes in front. Okay, and also I forgot to mention, but we'd be palpating the carotid when we were up here earlier. One one side at a time. We wouldn't include both. And that's 2 plus, normal, bounding, and we'd also listen with the bell for any bruit in the carotid as well. Okay, so then we'll be listening to the back, and yeah, if you can just flip around here so that your legs are towards this side, and then I will have your back to the. So we're going to be listening between the scapulas and the vertebra. We can start again at the apex. Deep breath. And go back from side to side here to compare sounds. Deep breath. And we can also listen up into the neck area as well. Okay, deep breath. From the front side. Anterior. Okay, deep breath. And again. Okay, 2 more. Right along the spine here, and then we'll go out to the sides again. Okay, and 1 here, and then 1 more final breath here. Okay, no adventitious breath sounds, so no crackles, no wheezing, no stridor, nothing unusual. Everything sounds clear. Again, we would have inspected the back first before we would listen. We would palpate, and everything looks symmetrical. There's no unusual masses, any tenderness anywhere. And then we would be listening to the lung sounds too. Also while you have their backside here, you want to look for any areas of a breakdown. You're going to be looking at that throughout the skin, but especially in the bony prominences. That's where decubitus ulcers will start. The sacrum and the scapula, for instance, and the elbows. These are going to be all areas that could break down if someone is in bed for long periods of time and not being turned every 2 hours. So I think we pretty much have you assessed at this point.
All right. I feel completely assessed.
Very good. Okay, so that's the end of my assessment. Thank you.